It's 2 a.m., you're home alone. Your chest suddenly feels tight. There's pressure building, spreading to your arm. Your breath gets shallow. You reach for your phone, but your hands are shaking. You're scared. You're alone. And you're wondering if this is really happening or if you should just go back to sleep. If you think a heart attack always announces itself with dramatic chest clutching and immediate collapse like you see in the movies, I have news for you. It doesn't. And that misconception could cost you your life. For adults over 60, especially those living alone, knowing what to do in those first critical minutes isn't just helpful information. It's the difference between survival and tragedy. Here's what nobody tells you. The average person waits 3 hours before seeking help during a heart attack. 3 hours. That's not because they're careless. It's because the symptoms are confusing. They're subtle. They feel like indigestion or fatigue or anxiety. And when you're alone, there's no one to say, something's wrong. We need to call 911 right now. But here's what makes this even more dangerous. Every minute that passes without treatment, more heart muscle dies. The longer you wait, the more permanent damage occurs. That damage doesn't just affect your survival. It affects your quality of life afterward, your independence, your ability to do the things you love. A simple trip to the bathroom could leave you breathless. Grocery shopping becomes exhausting. The life you've built can change forever because of decisions made in those first crucial minutes. And it's not just about the heart attack itself. When you're alone and panicking, you can fall. You can injure yourself trying to get help. You can make the damage worse by doing exactly what your instinct tells you to do. The stakes are real, the risks are serious. But you're about to learn exactly what to do. I'm going to walk you through 7 life-saving actions you need to take if you're ever alone and suspect you're having a heart attack. These aren't complicated medical procedures. These are simple, practical steps that can keep you alive until help arrives. Some of these techniques have been validated by cardiologists and emergency medicine specialists. Some of them will feel counterintuitive, but every single one could save your life. And the final method I'll share might be the most important one of all, something that takes just 30 seconds but dramatically increases your survival odds. Ready to learn how to protect yourself? Ready to make sure you're never helpless in that terrifying moment? Let's begin. Before we dive into the 7 life-saving actions, you need to understand what's actually happening inside your body during a heart attack. In the medical world, we call this a myocardial infarction, but let's keep it simple. A heart attack happens when blood flow to a section of your heart muscle gets blocked, usually by a blood clot forming in a narrowed artery. Your heart is a muscle that needs constant oxygen delivered through blood. When that supply gets cut off, the affected heart muscle starts to die within minutes. The longer the blockage remains, the more damage occurs. This is why time is everything. This is why every single minute counts. Here's what makes heart attacks particularly dangerous for those over 60. As we age, our blood vessels naturally narrow. Cholesterol builds up on artery walls. Blood pressure often increases. The heart has to work harder to pump blood through a more resistant system. All of this creates the perfect environment for a heart attack to occur. A 2021 study led by Dr. Rebecca Hernandez, published in the Journal of the American Heart Association, examined heart attack survival rates in adults over 60 who lived alone. The research team compared outcomes between those who acted immediately versus those who delayed seeking help. The results were staggering. Patients who called 911 within the first 10 minutes had a 73% higher survival rate compared to those who waited more than 30 minutes. That's not a small difference. That's the difference between life and death for 3 out of 4 people. Now let's talk about what you need to do. Life-saving action number 7. Recognize the real symptoms. This might sound obvious, but most people miss heart attacks because they're waiting for the Hollywood version. They're expecting crushing chest pain that drops them to the floor. But real heart attacks, especially in older adults, often show up differently. Yes, chest discomfort is the most common symptom, but it might feel like pressure, squeezing, fullness, or just an uncomfortable sensation in the center of your chest. It typically lasts more than a few minutes, or it goes away and comes back. But here are the symptoms that get missed. Discomfort in your arms, particularly the left arm, but sometimes both arms or just the right one. Pain or discomfort in your jaw, neck, or back. Shortness of breath that comes on suddenly, sometimes without any chest discomfort at all. Nausea or vomiting that feels different from normal indigestion. Breaking out in a cold sweat for no clear reason, sudden dizziness, or lightheadedness. Women and older adults are more likely to experience these atypical symptoms without the classic chest pain. This is critical. If you're experiencing any combination of these symptoms and something feels seriously wrong, trust that instinct. Your body is telling you something important. The key is this: you don't need to be certain it's a heart attack to take action. If you think there's even a 30% chance something serious is happening, you need to act immediately. It's better to be wrong and embarrassed than right and dead. Life-saving action number 6. Call 911. First, not a family member. Here's where people make a fatal mistake. You feel symptoms. You're scared. Your instinct is to call your daughter, your son, your neighbor, someone you know who can help you figure out what's happening. Don't do that. Call 911 first. Here's why. When you call 911, emergency medical services are dispatched immediately. They arrive with equipment and medications that can start saving your heart muscle before you even reach the hospital. They can begin treatment in the ambulance. They can notify the hospital so the cardiac team is ready when you arrive. Every minute of that preparation time matters. When you call a family member first, you're adding delay. They have to process what you're telling them, decide if it's serious, possibly argue with you about calling 911, then make the call themselves. You've just lost 5, 10, maybe 15 precious minutes. A 2020 study from the European Heart Journal found that patients who called 911 directly had treatment initiated an average of 23 minutes faster than those who called family members first. That's nearly half an hour of additional heart damage. When you call 911, stay on the line. The dispatcher will guide you through what to do next. They're trained for this exact situation. Follow their instructions exactly. They might tell you to unlock your front door so paramedics can enter if you become unconscious. They might guide you through taking aspirin. They might instruct you on positioning. Listen carefully and do exactly what they say. Life-saving action number 5, take aspirin immediately. While you're on the phone with 911, if you have aspirin in your home, the dispatcher will likely tell you to take it. Here's why this simple action is so powerful. Aspirin is a blood thinner. When you chew and swallow aspirin during a heart attack, it helps prevent the blood clot from getting bigger. It doesn't dissolve the existing clot, but it stops it from expanding and completely blocking the artery. The dose matters. You want to take 325 milligrams, which is typically one full-strength aspirin tablet. If you only have baby aspirin, which is 81 milligrams, take 4 of them. You need to chew the aspirin, not swallow it whole. Chewing gets it into your bloodstream faster through the mucous membranes in your mouth. Do not take aspirin if you're allergic to it or if the 911 dispatcher tells you not to. But for most people, this simple action can reduce heart attack mortality by about 23%, according to research from the American Heart Association. Here's what you need to do right now before you ever need this information. Make sure you have aspirin in your home. Keep it somewhere accessible, not buried in a medicine cabinet you'd need to search through. Know where it is. Check the expiration date. This is basic preparation that takes 5 minutes but could save your life. Life-saving action number 4. Sit down and stay calm. This is going to feel wrong. When you're scared and your heart is pounding, every instinct tells you to move, to pace, to do something active. You need to fight that instinct. After calling 911 and taking aspirin, sit down. Find a comfortable chair or sit on the floor with your back against a wall. Do not lie flat unless you're told to by the 911 dispatcher. Sitting in a slightly upright position helps your heart work more efficiently and can make breathing easier. Here's what happens when you panic and move around. Your heart rate increases, your blood pressure rises. Your heart needs more oxygen at exactly the moment when it's not getting enough. You're making the damage worse. You're also increasing your risk of sudden cardiac arrest, where the heart stops beating altogether. I know this is terrifying. I know staying calm sounds impossible, but here's what you can do. Focus on your breathing. Take slow, deep breaths. In through your nose for 4 counts. Out through your mouth for 4 counts. This isn't meditation nonsense. This is physiological fact. Controlled breathing activates your parasympathetic nervous system, which slows your heart rate and reduces the workload on your heart. Loosen any tight clothing, unbutton your collar. Take off your belt if it's constricting. Remove anything that makes breathing more difficult. These small actions reduce stress on your cardiovascular system. Before we continue to the final 3 life-saving actions, I need to ask you for a small favor. If you're watching this video, you clearly care about your health and safety. You're being proactive. That's exactly the kind of person who could help someone else survive a heart attack. Please, right now, hit that subscribe button and give this video a like. Why? Not for my ego, but because there are millions of seniors living alone who don't know this information. They think heart attacks only happen to other people. They think they'll know exactly what to do when the moment comes. But they won't unless they see this video. When you like and subscribe, YouTube shows this content to more people who need it. You might save someone's life tonight. You might save your neighbor, your friend, your family member from making a fatal mistake when they're alone and terrified. So please hit that button and let's make sure this information reaches everyone who needs it. Done. Thank you. Now, let's continue with the 3 most critical actions. Life-saving action number 3, position yourself for paramedic access. Here's a scenario nobody thinks about until it's too late. You've called 911, help is coming, but you're alone in your house and you're getting weaker. What if you lose consciousness before they arrive? This is why positioning matters. After you sit down, you need to think about access. If you can safely move to a location near your front door without overexerting yourself, do it. Unlock your front door if you can do so without significant effort. This allows paramedics to enter immediately without having to break down the door. If you live in an apartment building with a security entrance, this gets more complicated. When you call 911, tell the dispatcher exactly how to access your building. Building code, unit number, whether there's a doorman or a call box system. Make it as simple as possible for emergency responders to reach you quickly. Keep your phone with you at all times. If you move from one room to another, bring the phone. If you feel yourself getting weaker or more disoriented, call 911 back and tell them. They need to know your condition is deteriorating. Here's something most people don't consider. Have a plan for your pets. If you have a dog that might be aggressive towards strangers entering your home, think about this now. Can you close the dog in another room if you have warning symptoms? Tell the 911 dispatcher if there's a pet that might interfere with paramedics entering. They can coordinate with animal control if necessary. Life-saving action number 2, know your medications. When paramedics arrive, one of the first things they'll ask is what medications you're taking. If you're confused, scared, or starting to lose consciousness, you might not be able to answer clearly. This information is critical because certain medications affect treatment decisions. Here's what you need to do today, right now, this week at the latest. Create a medication list. Write down every prescription medication you take, the dosage, and how often you take it. Include over-the-counter medications, supplements, vitamins, everything. Print this list and keep a copy in 3 places. On your refrigerator where paramedics typically look, in your wallet or purse, and next to your bed. If you take blood thinners like warfarin or newer medications like apixaban, this is critical information. These medications affect how doctors treat your heart attack. The cardiac team needs to know immediately. If you have medication allergies, put that at the top of your list in bold letters or bright highlighting. An allergy to a common heart medication could be deadly if administered during an emergency when you can't communicate. Update this list every time your medications change. Make this a habit. It takes 5 minutes and could prevent a fatal medication interaction during treatment. Life-saving action number 1. Cough CPR is a myth, but this isn't. You may have seen viral social media posts claiming you can save yourself during a heart attack by coughing forcefully. This is called cough CPR, and it's dangerous misinformation. The American Heart Association has explicitly stated that cough CPR does not work for heart attacks and should never be used by untrained individuals. But here's what does work, and this is the most important action of all. The moment you recognize heart attack symptoms, your single most critical decision is immediate action. No hesitation. No, let me see if it gets better. No, maybe I just need to rest. Studies show that the human brain goes through a denial phase when confronting potentially life-threatening symptoms. We rationalize, we minimize, we convince ourselves it's probably nothing serious. This denial kills people. The moment you recognize symptoms, you move immediately into action mode. You call 911, you take aspirin, you sit down, you prepare for help to arrive. This immediate response protocol from first symptom to calling 911 should take less than 2 minutes. Practice this mentally. Right now, visualize yourself feeling chest pressure and arm discomfort at 2 a.m. What's your first action? Call 911. What's your second action? Take aspirin while staying on the line with dispatch. What's your third action? Sit down and control your breathing. Run through this scenario in your mind until it becomes automatic. Let's recap your life-saving action plan. You recognize the real symptoms, which include chest pressure, arm discomfort, shortness of breath, jaw pain, nausea, cold sweats, and dizziness. You call 911 immediately, not family members. You take 325 milligrams of chewed aspirin unless contraindicated. You sit down in an upright position and control your breathing. You position yourself for easy paramedic access and unlock your front door if possible. You have your medication list readily available. And you commit to immediate action without denial or delay. Listen, I know this is scary. Getting older isn't for the faint of heart. But your body is amazing. With proper medical treatment started quickly, many people survive heart attacks and return to active, fulfilling lives. You're not helpless. You're not doomed. You just need the right information and the courage to act when it matters. Imagine waking up in a hospital bed, hearing the doctor say, "You did everything right. You saved your own life by acting fast." That's possible for you. That can be your story. But only if you commit right now to remembering these 7 actions and taking them without hesitation if symptoms ever appear. Don't just watch this video and forget it. Tonight, before bed, check that you have aspirin accessible. This weekend, create your medication list and put it on your refrigerator. Next week, practice the visualization I described. Make these preparations while you're healthy so they're automatic if you ever need them. If you found this information valuable, if you feel more prepared and less afraid now, please remember to share this video with anyone you know who lives alone. Let's help everyone over 60 understand that being alone during a heart attack doesn't have to be a death sentence. Thousands of seniors have used this exact information to survive. You could be next. Watch the recommended video that's coming up next about recognizing stroke symptoms, because that knowledge is just as critical. Click to keep watching and keep yourself safe.